Welcome to KIMEcast, where we break through and cut the BS in sports medicine, rehabilitation, and sports performance, and talk about how things really work. And welcome to KIMEcast. Tony Mikla. I'm with you guys solo today, so we're going to do a little bit of a different approach to KIMEcast, and we're going to field some Q&A and some questions from the audience, if you will. So Jesse's our producer of KIMEcast and is going to ask me some questions, and we're going to play this a little more live, a little single-sided rants, if you will. So let's see how we do.
Be a little freestyle today.
Freestyle today, yes, indeed.
Yeah. So in the mindset that we have lots of PT students that come through our clinic rotation, and we have some young candidates out in the world. I've got some questions for you regarding that.
Okay.
Are you ready?
Yes. Let's do it. I like it.
You've not seen these questions.
No.
So this is truly a freestyle on the fly situation.
See what happens.
All right.
See what side of me comes out here.
Can't wait. All right. So, number one, when you think about new grads or early career PTs, what separates the ones who succeed from the ones who stall out?
Well, first, great question is curiosity, number one. Are they excited to be part of the profession, in a genuine way? Not like, hey, this is my first job and I want to go to work and I'm excited to make money, but are they really excited to learn and work with other people? Like the patients, because I think one thing I say to students all the time when they're going through internships or rotations with us, and they're always so excited that school's over, right? They're like, yeah, school's going to end, I'm going to graduate and there's not going to be any more tests. That's not true. So I believe you won't have to study for a test on paper, but you are going to get tested like a final exam for the rest of your life by patients. They're going to come in and ask real, practical, difficult questions. And the better you get, the more difficult the questions become because then people start seeking you out and asking really, really difficult questions. So I have final exams every day, and it's a final because if I don't answer the question of the patient effectively, they don't come back. So I don't get a chance to further work through my hypothesis or my solution with the patient to more of a long-term outcome. If my first answer wasn't good, or if I didn't answer the question appropriately, or they didn't feel like I had knowledge of the topic, they tend to typically move on. So it's the same live as it is in school, only I think the outcomes are much more real, much more authentic. So you have to be aware of that. But the ones that are successful embrace that. They embrace this idea of, hey, this is hard. The person in front of me needs my help. It's an opportunity for me to coach. And even if you don't have the answer on the first day, which you probably won't, you will have had the tools to find the answer. And I think that's the one thing that school does really, really well, is they teach you the tools, they teach you the foundation, the fundamentals of how to find the answers, of how to think through the problems so you can go and actually solve these problems. But we don't expect you to actually know it on the first day. And a lot of times, even for me doing this for 20 years, I may not know what the patient needs on the first day. I usually can narrow it down and be pretty darn close, but I may not be right every time on the first day. And I think being candid about that is actually quite important, to communicate with the patient and say, hey, I think it's either A or B. Could be a longer list, could be C or D, could be a couple more things there. And in order for us to find out, we need to work together. I'm going to have you do a series of movements or a series of modalities or whatever the treatment might be. And then I want to come back and see how you responded to those things. Let's see how your body responded to the stimulus that we gave it. And if that stimulus had a positive response, then we're on the right track. And let's kind of continue to build on that. And we're going to kind of learn how your body responds together. If he comes back and it's not good, and the fact that the outcome was undesirable, it got worse, or there was perhaps no change, then you have a decision to make, all right, if there's no change, do I ramp it up and be more intense? Or if it's worse, do I have to change direction? No, maybe I picked the wrong one, and it might be option B or option C as a solution, and then you kind of reset that expectation with the patient, and you go again. But in my years, as much as every patient would want the answer to be clear and concise and 100% accurate on the first time, I've never met someone who's not open to the idea that that's unrealistic, and they'll always be willing to go through a process of a sleuth or an investigation to find the problem, find the solution. And that's what anybody wants. That's what everybody that's having a health issue wants. If they have a knee pain, back pain, or even something more serious, they want to know, like, what is it for me? What's my problem, et cetera. And everybody realizes that every problem is a little bit unique and a little bit different. So even though there may be some textbook things out there, everyone's expression of that pain or that limitation is going to be slightly different. So there's tremendous amounts of variation. So because of that, I think our job is quite difficult, but the key to success is that you have the curiosity to explore it and to not give up. We say in KIME, we say to leave no stone unturned. That you're not going to give up in the assessment process or the evaluation process with somebody, and you're going to stick with them through it until you find out what the best plan or the best potential outcome is for that person, and continue pushing that barrier. And that's, if you hold that kind of value, I think you can be tremendously successful. But the second you give up, you lose your curiosity, you lose your passion to help the person in front of you, then you're probably going to struggle, at least in the field at the level that we deliver it at.
Yeah, I'd say that's true. And I'd also say that the ones that are really do well in our platform of KIME is that when they hit that wall and they're still curious, they reach out to a mentor or a senior person in our system that can kind of help them walk it through instead of them trying to do it all on their own. They don't have to do that. Yeah,
100%. I mean, you have to have some teammates that you can go to in these situations, and we set up that arrangement, so it's certainly there for the team. But you shouldn't have to feel like, nobody does this. Like, even like the best surgeons in the world, the best surgeons all have mentors and colleagues and groups they're a part of where they go and ask questions back to the forum, and they work together in a really effective way. So yeah, we do the same thing. It's really, really important to do that and ask those questions. When we look at hiring somebody and bringing them onto the team, we look for two main qualities. Number one is that they're passionate about helping people, and that they're passionate about the field, and that they feel like they can have an impact in helping people. And if they have that passion, that drives a lot of good things. The second thing we look for is that they can communicate. So are they comfortable talking to people? Are they comfortable engaging with people? Because if you can't coach somebody, if you can't talk to them, it's really hard to get someone to change their behavior or do a certain number of exercises or engage in the plan that you put together if you can't communicate what that plan is very clearly. So those are the two big factors. If someone has the passion to help and they have the communication skills to actively listen, ask questions, learn about people, then that passion is going to drive a lack of knowledge. So if, say, you have great communication and you don't know what's wrong with the person, even after you do all your tests and all the knowledge that you have, you still can't figure out what's wrong with the patient. The passion that you have to help the person and to fix the problem, solve the problem, means that you're going to go try to learn. So you're going to go ask teammates, you're going to go do research, you're going to go read, you're going to find ways to get that knowledge. So the next time you go treat that patient or see or engage with that patient, you're going to have a better answer than you had on day one. And that pursuit is what leads to excellence and greatness.
All right. Number 2. If you could go back and give your younger self one piece of advice early in your PT career, what would it be?
Yeah, this is a tough one for me because I had so many things go right.
Says you did it all.
Yeah, I did it all, and I mean intentionally.
Maybe that's the answer. You're intentional.
Yeah, that's for sure. I have nothing. Very few things in my life, much less my career, are accidental. I do believe there's there's somewhat of a fate or destiny and path that we're on. And I definitely feel like I do things with a purpose and with intention, and I'm very intentional about the way I put myself in certain positions to learn or to gain experience or to see things. I did a lot of things to see different perspectives of therapy. I was fortunate enough as an intern, as a student, to have a mentor and have a CI. One person was very McKinsey based. I had another person that was very Maitland based, and another person who was very Canadian or Norwegian strategy based. So I got to see like 3 major differentiating approaches to spine care during my young years. And at that time, those were the manual therapies that were very, very popular and still to this day stood some of the test of time as far as manual therapy goes. But that gave me a really great approach where I could see different aspects and different angles and then use those angles at different times with patients. And I wanted to see that out, to see like what some of the holes were, as well as some of the advantages were as well. And then from an exercise standpoint, I also got to be around some of the best exercise people in the world. And if I wasn't around them, I put myself in positions to either go to conferences or go to educational opportunities where I got to hear them speak, see them speak, and learn from them, so that I can bring those 2 things together, this exercise component as well as this manual therapy component. And I believe that that's, key to the success that I've had, is to bring those 2 things together, interact and engage in a really positive way. So I don't know that I would change a lot of what I did, but what I would definitely tell every student would be to really maximize the time while you're a student, as well as when you first get going out of school and you start to practice. Really, really search for, the best, the most current information, and also look at the trends of history. What's been going on, what have we learned over the years that the people are implementing. But get mentorship, see a variety of things. I think that the internship process in school is probably the most important thing, besides the foundation of learning and the anatomy and the neuroanatomy that you get. I think that's something you're going to build more understanding of in your career long term. So I do think that though anatomy has been stagnant, we've actually changed the viewpoint at which we've looked at anatomy. And neurology is definitely not stagnant. The amount of neurology and the speed at which we're learning about that is very exponential at this time. So learning the neurology now and then building an understanding of it over the next 20 or 30 or 50 years is going to be really, really massive. So that would be my take on that, is build those foundations. And then when it comes to internships, really make sure you get good options. I'd be very, very deliberate about this. So, I think there's phenomenal internships out there, but I think that list is short. But there are very, very good ones. And depending on what field of expertise you want to go into, but I would definitely go search them out. I would not just take the local one that's in your town because it's easy for you or because its housing is close by, that your boyfriend's in that town. So, it's convenient to go there, and that would be great to spend, 6 or 8 weeks in that town and be around that person. I don't think that's the right choice when you're setting up your career, your life for something this grand. And I think this is true. Like if I look at the surgical model, if you look at great surgeons, they chose really, really phenomenal fellowships and most likely very, very good residency programs. And that's for the rest of their career. They go back to those fellowships and those residency programs, and they go back, and that's a lot of where they learned how to be great came from. And those are the people that serve as their mentors and their influencers for the rest of their career until they become maybe an influencer or a mentor at some point. But that's very, very much where they get their experience from. And I think in our field, we aren't intentional enough about that internship process, and we look for it. I look for it in students that apply or people that apply to work for us. What kind of internships did you go through? Did you seek out the best and the brightest, or did you just go to something that was convenient and easy and maybe not the best of the best? I think you have a very unique opportunity as a student to go spend time with very, very good clinicians and learn from them. But once money gets put on the table, it's very hard to leave that salary or that income and go spend time doing internship things. But any chance you get, it's well worth it. To give you just the reason why I say what I said is that I was highly encouraged to go to Athletes Performance, which is what it was called at the time. Now it's called Exos, but I was highly encouraged to do that by several mentors of mine while I was in PT school. And so I set up that rotation for UOP, and we started it. And I was one of the first students AP ever had. There was me and one other gentleman that started together, and it really set off a path. And now I talk to everyone who asks me that's in PT school, what's one of the top internships you can get, and Exos I think is really, really high on that list because you get such a good experience there. There's other great ones too, like iFast is very good. Mike Reynolds is very good, of course. There's other professional teams that have good stuff. I think that what we're doing at KIME is world class in its experience for the student. It depends on what you'd relate to well and what you want and what you think you'll go into, but you want to be around therapists that are really pushing the needle and using the most current research and literature. And you'll find that that's not normal. So if you just go to the normal average clinic, you're not necessarily going to get pushed or get challenged in the ways that you would if you sought out those that are really pushing the needle and going best of the best. So that'd be my number one advice is really study the foundations in school. I had a student who's, this guy's like a savant. I mean, he's probably the smartest PT I've ever met. He's 10 years younger than me, really doing phenomenal stuff out in San Francisco, fully all private, like very, very unique individual and very unique programming. But he went to Western University in St. Louis. And the reason he went there, out of his own words, were that they never closed the cadaver lab. And by the time he was with me as a student, which he was just an undergrad or just a graduate student, he had already dissected over 40 cadavers, which I've never met a PT who's dissected more than probably, we had 6 at UOP, but I've never met a PT that's been more involved in like that, a number greater than 6 or 10 ever. So that kind of curiosity and drive, like that experience at that, especially at that age, really drives a knowledge level that's uncommon. And that's kind of what I would say to look for is where can you find people that think above and beyond and think outside of the common. And I think that's well worth the effort to get that internship.
I think that's a great lead in. We talk a lot about this next question quite a bit, which is clinical excellence. How do you define clinical excellence, and how should a young PT think about building it? So you partly answered it in your previous question.
Yeah. So certainly clinical excellence, I mean, outcome is, the ultimate measure. Like, did the person get better? How many patients do you get better on a regular basis? What's your percentage, if you will? And there is statistics on that. You can do functional outcome measures. You can look at a variety of scores in that space. And there are many PTs who keep those stats. And I think it's good. I think that, Atul Gawande wrote a book called Better. He wrote 3 books about the medical industry that were really, really, really big. One was called Better, one was called Complications, and one was called Checklist Manifesto. And they're really great stories about healthcare and how really healthcare has gone wrong. So one of the big stories he talks about, and I believe it's in Better, is that the idea of doing an autopsy really fell out of favor in the late 1900s and became something that was not practiced very much by the medical community. And, people would think, well, big deal. They don't do autopsies anymore. And that was the idea. Is like there were religious reasons why maybe not doing an autopsy. There's certainly an expense, like who's going to pay for it? Does insurance company pay for it? Do the people pay for it? And what's the real benefit of doing an autopsy? The person's already passed. Do we really need to,
Do we care?
Yeah. Do we need to know why? Do we really need to go through this process? Is it more painful than it should be? So there's a lot of emotion around the concept, which is fair. But the problem for the medical community is that the doctor provided a diagnosis, at some point during this person's life, probably either in the hospital or something, and they ended up dying. And maybe the doctor said they had lung cancer. But if you don't do the autopsy, we never really know if the doctor was right. And if the person goes to the grave and the doctor thinks that he said they had lung cancer, so they died of lung cancer, and they go to the grave dead of lung cancer, well, then we're advocating that the doctor is right in that diagnosis, which then subconsciously drives that you look for those same symptoms and then diagnose the same way again. But if there's no feedback loop to say that you're wrong,
yeah,
then you could see how you could start to go on a trend of misdiagnosis that could last you quite a long time. So he wrote about this idea that since the autopsies have been taken off the thing, actually there's no check system to say that the doctors are actually right in the diagnoses
in the first place. And think about how much innovation there's been in medicine over the last 50 years to where this practice has been evolved, where now there's
not only is there cancer, but there's millions of different kinds of cancer. I remember when my dad's gone through this, he was diagnosed with a certain blood cancer, and the first diagnosis he had was maybe that it was just CLL, and then it became another form that had been known to be very, very fast acting. So they gave him 5 years to live, which was obviously really traumatic for him and for our whole family for that period of time. It was a big deal, and and they gave him 5 years to live, but over 4 years he had no symptoms. It was found from a blood test, so there was no symptoms at all. And so we kept going back to the doc and going through the process of reassessing and doing the blood work and making sure there was no progression in his white blood cell count, et cetera, and reported symptoms, and he really had nothing, and nothing was changing. And it's like, well, we're 4 years in, we got 12 months to go here. What's the shit's gonna hit the fan, And so, he was living like he was dying, like literally, and like didn't want to do things. And with white blood cell count rising was a big risk of getting sick and stuff, really limits the way that you live, all these things. So blah, blah, blah. So we finally wanted to we should have got a second opinion probably faster and sooner, but there's a lot going on there, and I was encouraging him to do so. So we finally did, and we went to Stanford and got a second opinion, and the doc was absolutely amazing. He came in and he's like, yeah, so you do have what they said. The problem is that 4 years ago, the articles that were written about this identified a certain type of it. And we've learned in the last year, actually, with the new research, that there's two types. And if you had the first type, you'd be dead. You have the second type, which means you'll be totally fine. It's very treatable, and there's nothing to really worry about.
That's a big difference. That's a big difference than you're dying.
Yeah. So it's quite a change. It's quite a day. And then going back to the previous doc, and then this was what was really amazing from a communication standpoint. We go back to the previous doc and say, hey, this is what we found. Went to Stanford, this is what we found. And the guy's like, well, obviously, if you had the first one, you'd be dead.
Oh my God.
And we're like, but that wasn't obvious to us. Because we're not reading the research every 3 months that's coming out,
Communication is key.
So the communication piece is a little bit desired. So my dad's still doing great, and so which is great. But the concept there is, without getting that piece, the outcome-based measure, you really don't know if you're doing good work or not as a clinician and practicing clinical excellence. So as those two examples, one doctor, I would say, in his mind, thought he was being excellent, gave my dad a diagnosis, gave him a plan, which at the time was best he could do, but then failed to follow up on that and produce consistently excellent results. Going to another guy, gave us another opinion and yielded not only the information we wanted to hear, but accurate information, but that evolved over time, which is fine in the way that science and that health tends to work. So when we look at clinical excellence at KIME, we look at something more of a zoom out type of a view. At its first lens is a zoomed out view, and that zoomed out view is essentially how busy are you. There's no such thing as a good doctor who's not busy. There's no good anybody who's not busy. If you're the best player on your team, you probably are playing a lot of minutes in the game. Who would put the best player on the bench? It doesn't make any sense, right? And if you're a good doctor, you get good outcomes. People tell their friends, and you get busier. And it's very similar. And the same goes for physical therapy or any profession. If you're a good mechanic, or if you're a good plumber, or whatever it is, or you're a good IT consultant or a good software engineer, you're going to get more jobs. More people are going to be interested in your work because you do excellent work. So being busy is certainly a measure of excellence, but that can be misguided and can't be your exclusive measure. But it is one of our measures that if someone's not busy, the chance that they're truly excellent is low. If they are busy, their chance of excellence is higher, but not guaranteed. So then the second variable would be, are they getting good outcomes, or are the patients satisfied? So we use a patient satisfaction as the next thing that we look at, because people who aren't getting better aren't satisfied. So it's very easy to be like, okay, you're busy and all of your patients claim that they love working with you and they're satisfied. So those two components make up a good part of what we consider to be clinical excellence. The third thing we would add would be outcome measure. Are you getting consistent outcomes? And that would be a great measure if we had the same patient 1,000 times over. So if everyone had a rotator cuff repair that was the same by the same surgeon, and then we were the only variable, then the outcome measure would be very, very good. It'd be very, very consistent. It'd be like, well, you're only getting 70% of those patients better. So that's, good or bad. But the fact that there's a million variables, and we see shoulder patients and knee patients and, chronic injuries and acute injuries and everything in between, that getting consistent outcome metrics as a feedback tool is one of the more difficult things for us to do, just like doing an autopsy. It can be difficult to do and difficult to get consistent measures. So we use it as a tool. We're interested in it. But the top two things we use are you busy, and is the patient satisfied with the care they're getting?
Yeah.
Which is, if you're familiar with what's called an NPS score, it's pretty much the same thing. Like if you saw somebody and you asked them, how was it? Would you recommend the service they received to another person? And it's a 0 to 10 scale.
Yeah.
If they answer 9 or 10, then yes, they're considered an advocate and they're a promoter. But if they answer below an 8 or below, they're likely not a promoter. And if they're a 6 or below, they're a detractor. So it's a very simple scaling test that's used extensively in the marketing world, and it's accurate.
It works.
Yeah.
All right. Okay. In sports performance setting, what common mistakes do you see even smart, motivated PTs make when working with athletes? I could probably say that to be anyone, but
yeah, there's a lot to bite off there. Yeah, there's a lot to bite off there. So what are the mistakes that are made by sports PTs? Man. So for me and for what we're doing as we consider a sports PT is we're looking at really being a high performance director has been the language we've been using when we describe a sports PT. I really don't like sports PT as like its own thing. It's a way too vague of a statement. So I like the idea of high performance director as kind of a more specific statement about that person. And so with that being said, you have to understand how the whole body functions and can be optimized. So that gets us into like looking at our big pillars that we feel are valuable in human performance, which would be sleep, nutrition, stress management, mindset, and movement. So most PTs will focus mostly on movement and certainly respect those other pillars and categories that they exist, but maybe not focus on them as primary intervention streams. And I think a high-level sports PT or a high-performance director needs to understand the impact of all 4 of those pillars on the body. So the number one thing would be to be too narrow focused, to be too specific, to be too diagnostic on one particular tissue, and not see the person as a whole.
Yeah.
I think is by far someone who's already good, but maybe not excellent or great or world class. That would be an area we would see would be a problem. Is a little bit too much focus and detail on one specific thing and not seeing the whole. So what I mean by that, and my experience here is clear. So I learned earlier in my career when working with throwing athletes, for example, we could have a throwing athlete come in, they could have an elbow injury or they could have a shoulder injury or whatever the case would be, and they couldn't throw. So then we'd go through this whole process. It might take a month, it might take 2, 3, 4 months, and we help the tissue heal, whether it be something in the elbow or something in the shoulder, like a biceps or something like that. We do the process, we help it heal, we facilitate it, we get the range of motion back, we get the strength back, we get the function back, like they can do heavy lifting again. They can even play catch again, and everything's great. The problem seems to be solved. And then what's happened several times is the problem comes back. So it was good, maybe it was good for 2 months, maybe it was good for 6 months, maybe it was good for 2 years. And then a problem reemerges. And what I learned in doing this a few times was that I had to intervene as a sports performance PT and as a high performance person. I had to intervene in the mechanics, the loading strategies, and the dosage at which they actually did the sport to really understand their risk of injury and maximize their performance. I couldn't just treat the tissue and then say, okay,
You're good to go.
you're good to go. Yep, you're healed. Because we did that. We've done that many, many times. You treat the tissue, treat the body part's healed, but it's the mechanics or the mechanism or the angle or the loading pattern or the incompleteness of their complete training program that leads them down a path that injury happens again. They're vulnerable to that injury and it happens again. So I think that the lack of completeness in the thought is really the key characteristic of maybe someone who was in that field of sports PT, doing sports stuff, maybe not finding ultimate success. Is that I think you have to really understand the sport, and then I would highly encourage you have to watch the person do the sport, or gather enough data that you didn't have to watch it and you can see it from the data. So for example, like a pitcher, I'd want to see them throw the ball. I want to see video of them throwing the ball. And then I might look at other information as well as like spin rate, number of pitches in a week, pitches in a season, where their success comes from. Are they getting success from the fastball? Are they getting success from a split? Are they getting success from a curveball or something else that they're throwing? And if they're throwing that pitch at a high frequency because it's successful, does that put a certain amount of stress on tissue that's going to increase their risk? As an example, that would be a very, very specific focused example, but that's certainly something to consider. So that's a big deal, is looking at the overall big picture. Other than that, you can learn the tissue healing, you can learn the hands-on techniques, you can learn that stuff. The other big factor I'd say beyond like understanding the whole thing is being able to communicate and engage with the athlete through the process and helping coach them through the process and integrating with all the other coaches that need to be part of this process, because no athlete lives in a silo. They at the very least have a family and probably a skill coach, like a basketball coach or a throwing coach or whatever, a baseball coach, that they would need to work with. So you have to communicate to all those people, to the client, to the athlete, to the coach, to the parents, about what's going on, where we're at in the process, how we're going to get to the next steps, and then what it's going to look like as things continue to progress forward is really, really a critical aspect of the process. And just working one-on-one with the athlete, oftentimes, in my experience, isn't enough. Though it's good, it's not enough to truly be excellent. So I think that's a big component of it. And then, of course, you're going to have athletes that are going through a lot of challenges. It can be very psychological. To have hurt your knee playing the sport, that was always my one question. If the athlete tore their ACL on the field, all the rehab we could do in the world for 6 to 12 months to get them back on the field, the second they go back on the field, I don't care who they are, there's going to be a thought on their head. This is the field that I played on, and the last time I was on it, like I went down hard and I haven't been able to be on it in 12 months. That's a big deal. And whether or not it's an active thought or a subconscious thought, it's there. And the way that you've prepared that person to deal with that problem is really, really important. And of course, that comes down to loading, exercise, and all of those things, as well as communication and confidence about the process. So there's a lot to consider far beyond, it's this tissue and this is the healing time frame, and this is the exercise you do to get it stronger. There's definitely much, much more to do than that. Those would be the big things I'd think about.
All right. All right, I've got two more. Moving on to more of like a recruitment aspect. How does mentorship feedback actually work inside of KIME, and what can a new team member expect week to week?
Yeah, so the mentorship process is pretty custom. So for us specifically at KIME, what happens is coming on to the team, there's an onboarding process. So as part of the onboarding process, there's two large phases of education that are required and that are part of that process, and they're relatively immediate. So, you do phase 1 and then you do phase 2. And those go from, phase 1 is essentially how to function as a PT in the system, what the documentation system looks like, how the billing system works, how all the systems work so that you can function effectively. And then the goal is that you realize that you have to focus mostly on patient care exclusively and just rely on these other systems behind you to back you up. But you have to know how to use them and with how they work and how to communicate with those people. But the idea is that you learn that, and then you can really focus on patient care after the phase 1 process. And then phase 2 is like, let's talk about how to do that patient care in a very strategic, consistent way so that, again, you can have success and put yourself in a position to be successful. So that's what phase 2 is all about. Now, during this, there's certainly going to be some focal points where you have strengths and you have weaknesses, and you're going to want to work through those things, and you're going to have goals that are, both personal, they're financial, that might be growth-based or performance-based, that you're interested in improving and interested in attaining. So that process we call our IDP process, or an individual development plan, and it's individual, which means that it's custom.
Yeah.
So if you want to make a certain amount of money, then that might be a high goal for you. So we would talk about how that's possible and how to maximize that without compromising quality of care in those variables. If your focus is, I don't really care about money, I just really want to see a certain type of patient, a certain population is really my passion, and I'm really after seeing, golfers or whatever it might be. So then it's like, okay, let's talk about how you can maximize that. Like, where are the opportunities in that? And let's strategically build a plan for you around doing that. And so the IDP would determine your moving forward, what your mentorship would look like. So you have a guide in this process that's guiding you and working with you on what it is that you'd like to accomplish. It's your responsibility to set the goals, and it's the guide's responsibility to support you and understand how to set the plan to achieve those goals, and then working together and going back and forth along the process. So it's different for everyone. Sometimes it's a daily meetings. Sometimes it's weekly meetings. Sometimes it's quarterly meetings. And sometimes it's more biannual meetings, depending on where you're at in your process and in your life. So, we all as humans have lives and things that happen. So as a new grad, you might be really excited and have the first year where you can really get after it, or maybe you have the first couple of years where you really want to get after it. And so you might learn things really fast. There'll be a lot of more rapid learning and development. And your mentor may work with you extensively on like, what are the courses to do, what things to learn in the clinic, what things to study, all these things. And then there might be a time in your life where you're getting married, maybe you're having kids, and that's taking some of the priorities away from how much free time you have to learn. So during that time of your life, you might tone down some of your professional development a little bit and focus on some other things, which also we coach you on, like how to do that effectively without losing quality of patient care, without losing some of the things that are important to you that you've built during this process. So there's different kinds of mentorship there and different ways to meet the need. But the key is that it's a custom approach based on the person's plan. They're given a guide, and of course that's can be adjusted, but that hasn't really happened yet in our scenario. But they usually have a guide, and they work with that person, and it's a bond they form to work together to get into a certain place. Now, say during that process, you and the guide or the mentor, you want to learn about something that maybe your mentor's not really experienced in. Like, say it was golf, and the person that you're working with in our team is not into golf.
Yeah, it happens.
Yeah, that happens. And so then it's that person's responsibility, it's your mentor's responsibility to identify a new mentor for you in that specific space. So it could be an internal person in our company, or it could be something external. Say, okay, that information we don't have, so you need to go get it from here. And the intention might be that you become the expert in that and the subject matter expert in that space. And then in the future, the next person that comes up that really wants to, excel in golf, you might be asked to mentor that person and down that path, right? So it's kind of a constant growth and evolution process where you come in and you're learning and you develop a certain level of credibility and expertise, and then eventually a certain level of mastery. And, then you turn around and you help somebody else up the ladder, right? So as you're climbing the ladder, you're learning things, and then you're reaching back and helping the next person up the ladder behind you. And
I do love that about us. I love that about our employee life cycle and how we bring people through it and find opportunities that matter to them and align with us. I think we do really well at that.
Yeah, it's really important to us. We look at one of our values is integrity, which means that, if you believe in who you are and your character and what you do. And I think it's really tough if you thought you were really good at doing something, that you didn't feel the need that you should teach other people how to do it as well. Because obviously if you're really good at it and you're really helping a lot of people, I think we have a responsibility to teach others how how to help people in a similar way. Because let's be honest, like you can't help everybody. There's, however many billion people are on the planet, and there's one of you, it's just not going to work out. So you might as well educate others and try to expand that reach, that impact that you would have.
Wonderful. You have this amazing ability to answer future questions and current answers. So I'm going to end it with this one, which is, what are you personally most excited about for the PT profession at KIME?
Yeah, so I think the PT profession's in a certain crossroads and has been for a while. And I think we're seeing more diversion from the previous path, which has been great. I think as a profession, we don't have great public leaders, which I think is fine and totally acceptable and probably normal. And it's time that we see more of the private leaders that are running organizations and companies that are doing great stuff, step forward and look at what those companies are doing, what those organizations are doing, and the impact they're having on people. And our young folks need to be looking to them as to what direction to go. We've really been strongly ingrained from a young age in this field to go towards the government agencies like the APTA, which is it's its own nonprofit group, but it's still a national agency that's in Virginia, next to Washington, D.C., for a good reason, with an effort to try to lobby and, kind of influence our state licensures and our national licensure and our national exam and those types of things of who we are and what we stand for. And I think that's great. I mean, I think we need that organization to do what it does. I think that organization is really, really struggles to find its way, and it's way too broad of a field for that organization to be expected to give us leadership or guidance in specific spaces. So like if you loved aquatic therapy, good luck with the APTA. Or if you love sports physical therapy, good luck with the APTA, because the size of our groups are so small that it's hard for us to be represented as strong as we could be. Versus if you're like in an acute care or hospital setting, you can be very, very well represented because there's so many of those licensed professionals in the country. But I would say that government agency's focus is
more for the majority.
Yeah, it's for the majority and kind of misguided, because that person working in that space doesn't have a lot of control over the space they're in.
Right.
That space is determined by the hospital systems, and much bigger, larger systems are determining that area of expertise. More so than the PTs that are in it, because there's just a different level of finance, a different level of insurance. There's a different level of management that is there's so much bureaucracy and control above it that I think it's a very, very difficult climb to do something that really breaks the mold. So, and I think that's the largest population of people that we have in licensure in the country is in that space, and therefore they should be represented by the APTA, and I think that's wonderful. But as a result, the APTA can't represent them and represent some of the other small private groups, really, really well across the board. So I do think that we have to look to more of our private leaders to set the tone and to drive the profession forward in a good way. So one of the things that we're passionate about at KIME is to be one of those folks that does drive best practices and best care forward. What I'm really excited about is that we have gotten to the point now that we are at a certain size that we're starting to really be able to dive into the things that I've been passionate about for quite some time. I feel like as we're having great outcomes and we're doing a great job with patients and we're making a large difference in people's lives, athletes' lives, active adults' lives, that we have methodologies and things that have been very, very effective and very, very proven now for the better part of a decade. And now we're able to actually do research on those things, and let's dive into the details a little bit more. Let's dive into the process a little more. What's really provided the success that's gone on there, and then if we can research that, understand what really the key components are, what really the pivotal factors are in the success. Not just saying we think that this works, but actually prove that this variable seems to be the one that moves the needle. Then be able to then educate other people, this is what moves the needle. so that other business owners, other PTs around the country can say like, hey, that works. If I was able to apply that with this kind of consistency, I too can yield these types of results on a regular basis. When we do that, we really start to make sizable change in the communities in which we're serving in an amazing way. Where instead of a one-off situation where you have one PT working with one patient at a time, maybe they see, in our world, they see 11 or 12 people a day. In some worlds, they see 25 people a day. But at the end of the day, it's still a very limited number. You can only see like, I think we're seeing like an individual PT in our company would be seeing like 400 or 500 new people a year. That's not a lot of people. But if there's 30 people or 40 people or 50 people seeing 500 people apiece over the course of the year, well, then that starts to get kind of exciting. Now you have thousands of people that you've impacted and thousands of people that are starting to learn how to take care of their body in a more effective way, to learn better strategies, to get healthy, to do the things that they're passionate about. And that's a really exciting thing to move forward. And if we take that to an educational point where we're educating other PTs outside of the KIME system, as well as those that are in the system, then that reach becomes very exponential. And so that's probably the most exciting thing for me, is I feel like that we're at a tipping point to have the bandwidth to be able to not only yield great results consistently, but then research it, and then next step is educate others on how to really do it and what the pivotal things are. And then we can really make an impact on people's lives. Because I think people need coaching. I think that we're seeing a lot of change right now in the United States as far as education on health. It's been an evolving thing for certainly the last decade. Eating healthier, sleeping better. Like, everyone's talking about the big things.
Oh yeah.
Let's eat healthy. Oh, yeah. Let's get sleep. Let's manage stress. Let's move more. Like, any one of those things, no one would be surprised if you told them, hey, you should sleep more. And be like, yeah, well, obviously. But then the problem,
if only I could.
Yeah, and that's the problem. If only I could. Like, no one has had to do it. Like, it's the same. We had a conversation with a researcher just a couple of months ago where we were like, we are really interested in how you reduce risk of ACLs in female athletes. And the researcher's like, well, we already solved that problem in the late 90s. And our answer to that was like, no, you didn't. Because actually, there's more frequency now than there was in the late 90s. So even though you knew how to solve the problem, and we know what exercise regimen is required to solve the problem, we as an industry, we as a licensed profession, we as whatever people have not solved the problem.
Clearly.
Although we know what the answer is, like, just like eating, like, we know that you should eat healthy and eat organic and eat natural foods. Like, but people in this country still don't do it.
Sometimes it's hard.
Yeah. I think that's the hardest thing to do in this country is eat healthy. I mean, it's unbelievably difficult. So now this is where, you're seeing, in some people's opinion, it's good or bad, whatever it is. But now you're seeing the government actually like change the rules so that it's almost impossible to make a really bad choices, right? Let's take the bottom 20% of choices off the menu so that you can't actually,
go down that
drive
hole.
yourself down that hole. Yeah. So I think that, that's where you see some of those things come into play. But yeah, I'm excited about that, about the impact that we can make, because I think that people are much more aware. I think that in the early 2000s, people weren't aware that certain food was bad and that, eating more natural foods were good. And as much as stupid as that might sound now, or even how important sleep is. Like, now, people always thought sleep was like valuable. But like, now the evidence and the research around sleep is it's by far the number one factor in predictor of performance and longevity. If you want to have a conversation about anything that's going to improve your life and longevity, sleep is by far number one.
Yeah.
So it's not even close. And so the evidence has only proven that, though, like really proven it, and like made people like make the move over the last probably 5 years on that category. So I think that now that people in general are moving into that idea of health, they need coaches to help coach them to like, how do they actually do that? How can I actually improve my sleep? How can I actually improve my eating? How can I actually improve my exercise and movement within my day? One of the conversations I have every day with people is, how are they going to get the movements in that are healthy? Like, because they'll say, everyone has an excuse, right? I work all day, or I'm traveling, or I don't have access to the gym, or I can't afford the gym, or I don't have time, or, whatever it is.
All self-imposed.
And then they're real. It's very real. Those are limiting factors. So then it's like, okay, well, can you give me a minute or two at this point in your day? Like, say, hey, when you're about to fold the laundry, can you do 5 squats before you actually fold the shirt? Maybe after you fold 10 shirts, you do 2 squats, then you fold 10 more, I don't know, whatever it is, but ways that you can just engage some other movement into the day.
Yeah.
And it's a massive way to really gain ground with a client, with a patient, where you can really see them start to engage. I had this conversation with somebody the other day, and it was really enlightening for her. I didn't realize I did it when I said it to her, but I was like, she's like, well, the only time I have to exercise is between 11 p.m. and 12 p.m. at night. And she's right. She's a caregiver for 4 people. So she has a tremendous amount of stress in her own life, and she's a mom and a caregiver and all these things. It's really, really difficult. And her going to the gym is like not going to happen. But she has some stuff where she needs to get stronger. She's actually coming off a rotator cuff that needs to get stronger. So it's like, how are you going to get it in? And so I talked to her about some of these things. I said, hey, when you're making coffee in the morning, can you do like 10 or 15 arm raises? And she's like, yeah, I could. Yeah, obviously I could do that. I was like, okay, well, let's do it. Let's commit to that,
Yeah.
Or when something else is going on, I can't remember what the example was that we did, but, if you have stairs, every time you go down the stairs, on the bottom stair, do 5 step downs or, whatever it could be. And then like, yeah, I could do that. And you start thinking about that, maybe that ends up being 50 in the day, which is a pretty good number, more than you would have got if you'd gone to the gym and done, 3 sets of 10 and done 30 in a row. So those types of things can be really, really impactful. And I think that in our profession, that's what people need as a coach, as to how do you get in the right stuff that's going to move the needle. And I think that's the direction of the field, because the information is no longer the variable. The knowledge is no longer the variable. So anyone can go into any of the systems now, whether it be Gemini or ChatGPT or any AI system, and ask it, hey, if I had a rotator cuff repair and I'm 6 months out, blah, blah, blah. How strong should I be? What exercises?
Oh, it's amazing.
What exercise should I do? And I can almost assure you that what that thing is going to produce, it will be far better, with likely pictures and video if you want it. It'll put it into a presentation for you if you like, in the slides.
Sure will.
You can get it in any format you want, and the knowledge is all there. But the question that still isn't answered is, you gave it a timeline, but you didn't give it the metrics of like how good you are, how strong you currently are, or how well you healed, or what your history of healing has been, or if you've had 5 rotator cuff surgeries and this is the last, this is the most recent one, or who knows what. It doesn't know that. And so therefore it can't customize that plan to you. And that, I think, is the glue of what our profession should look like, is take a good intake of the person, the history, what's going on with that person, how they came to be, why they're in front of you today, and then all the knowledge you have about whatever it takes to get this healing process dialed in, and then blending those two, knowing that you can't just, giving the protocol over isn't the solution. We've proven that. But coaching is the solution. You have to know the protocol and know the person, and then you can be the coach or be the guide, if you will, to that process. And to me, that will always be exciting. I think even a PT that's lacking knowledge could literally go into AI and ask AI the same question the patient would, and have the knowledge gap be filled in 10 seconds. So now it's a matter of coaching to the knowledge, which I think is what we really are all about, and able to do it at a higher and higher level as we continue to grow.
I'd agree.
Cool. Well, thanks, Jesse. Putting me on the spot and
it's always fun.
Asking some questions. Yeah. So hopefully you guys got some value out of that feedback, that perspective, that individual perspective of me and my experience. I certainly hope that it helps you drive down your path as to what direction you're headed. Whether you be if you are a physical therapist or looking to become one, and you're on that path, hopefully that gives you something to think about. And then those of you that are patients or clients, whether they be of ours or other PT, hopefully it gives you some understanding of maybe who the person is that you're working with, how they can help you, and maybe how they think and how they approach that thought process.
And I'd like to add, if anyone has questions for Tony, email us at KIMEcast at KIMEperformance.com.
Yeah, please do that. KIMEcast at KIMEperformance.com. Or go on, make some comments in the video on YouTube, whatever it's on. Feel free to comment in the comment section, and we'll respond to you there as well and can respond and answer any questions you have there. So thanks for listening. We'll see you on the next one.